All right, welcome everyone to our webinar today, our public webinar for February. We are just really pleased to be able to partner with the Parkinson's Foundation in bringing you really important information on something called their Aware in Care program. So the official title of this webinar is Aware in Care Information Session, helping individuals with Parkinson's disease stay safe while they're in the hospital. My name is Lori Gousset. I'm a representative of LSVT Global. I serve as their Chief Clinical Officer of LSVT Big, but I'll be moderating today's session and joining us as our key presenters, and just really honored to have them today, are Maria Allen, a physical therapist who is a Parkinson's Foundation ambassador for the Aware and Care program. She also happens to be LSVT Big certified. And also joining us are Michelle Hobb, a speech language pathologist who is also an Aware and Care ambassador for the Parkinson's Foundation. And she is a really loyal supporter of the LSVT Loud program as a speech language pathologist. So really happy to have both of them here today. And for all of you who are joining us, whether you are a therapist, a person with Parkinson's, a family member, caregiver, I think all of this information is going to be really relevant and important to you, and I believe very helpful to you going forward as well. Before we go any further, I would like to take a few minutes and let Maria and Michelle introduce themselves. I think they do that best, and so we'll go ahead and start with you, Maria, if Beth will spotlight you, and hopefully you can just tell us a little bit about you.
Okay, good morning, everyone. I am a physical therapist, and I've been a physical therapist for a very long time. When I've been working with Parkinson's disease primarily over the last 10 years, although I have over the career seen a big change in the focus of how therapy works with people with Parkinson's and the whole management of this chronic disease. So I run a basically coordinate a Parkinson's program in a home health company on the central coast of California. We see about 300 different people with Parkinson's disease, various levels of Parkinson's problems every year. And I mentor and teach and work with all of my physical, occupational, and speech therapists. So I get to help case manage and do a lot of mentoring and teaching. I also do a lot in the community with our local Parkinson's groups. So our local support groups, I do a lot of talks for all of them. I work closely with our movement disorder specialists and try to really just bring everything I can to our local Parkinson's community. And one of those things is the Aware and Care. Being an Aware and Care ambassador, it really helps me bring really important topic to spotlight that and get it into my local community. So that's why I am here today.
Well, thank you for joining us, Maria. And I think as a physical therapist with so many years of experience, you have many stories that you can tell. And I'm looking forward to hearing some of those stories today as we go through this next hour, really interviewing both you and Michelle and getting to know more about the Aware and Care program. So with that, let's turn the spotlight over to Michelle. And Michelle, tell us a little bit about yourself.
Yes, thank you. Well, first of all, I have to say that this is like pure heaven for me. It's blending the two things that I love the most, which is LSVT and the Parkinson's Foundation together. So I wouldn't be able to do the things that I do on a daily basis, first and foremost, without LSVT. I became certified 18 years ago in LSVT, and it truly has changed my entire perspective on working with people and helping them to live their best lives in all facets of living. So I am in Manhattan, Kansas. I've been here for 20 years, almost 20, actually 22 years now. And I've been working with people with Parkinson's for the last 19 years primarily. I had the great fortune of working for Metalark, which is a continued care retirement facility, and was given the opportunity to, about 16 years ago, to start a program for people with Parkinson's. And since that time, we have been able to affect people's lives through exercise, engagement, and education, and just helping people to feel empowered when living with the disease process of Parkinson's or Parkinsonian type diseases. So I've also been able to work with the Parkinson's Foundation Heartland out of the Kansas City area for many years, and have really valued the opportunities to work with people throughout the state of Kansas. So I'm a rock steady boxing coach as well. And so I love being able to work with individuals with Parkinson's and help educate you more today.
Great, thank you. And as I listen to you and read your bios, I'm just really grateful for both of you to be here with us today. Clearly, your passion for Parkinson's extends beyond even the Parkinson's Foundation or LSVT. You really are involved in so many things in your local communities and nationally too that help people with PD. So thank you for your time. A few disclosures. The honorarium is offered to both of the panelists today for sharing their time and expertise. A few logistics right now, just to eliminate background noise, your microphones are muted. However, this is a really open dialogue webinar. We would welcome your questions. We want you to leave feeling better informed about the Aware and Care program. And there are a few ways you can do that. The easiest is just to type your questions into the chat box on your Zoom control panel. And Beth, who is our moderator behind the scenes, Beth Peterson, in case you're having any technical difficulties, and in fact, she's listed as Elizabeth Peterson. You can message her, but she'll be monitoring for questions. I will be too as well. And we will try to get all of your questions answered by the time this webinar is over. If we run out of time, you can always email info@lsvtglobal.com, and we can forward those questions to Michelle or Maria as they relate to the Aware and Care program, and I'm sure they would be happy to get back to you on that as well. In terms of the handouts, Beth is going to be uploading 2 handouts to the chat, and I would recommend that you just open them. You'll have to click on them to download them and save them to a file on your computer or device. One is a handout of the slides from our PowerPoint slideshow today, and the other is a really important handout on how you can order your free Aware and Care kit. And there's a QR code in there that you can print out. You can share it with people, either print versions or electronic versions, because the ultimate goal of the Parkinson's Foundation and us too is that we want to get an Aware and Care kit in the hands of every person with Parkinson's disease out there. And you'll learn a little bit more what's in it and why we feel that's so important. So be sure to download those handouts. Those will also be emailed to you after the webinar. So if you're having any difficulty right now downloading that to your phone or mobile device, no worries, you'll get it via email as well. At the very end of the webinar, you'll have an opportunity to answer a quick survey. We just ask that you do that. The surveys give us a lot of great information on what we can do better, what you think we did great, maybe questions on what you'd like to learn more about in the future as well. A little bit of brief information on continuing education in case you're a therapist joining us for today's webinar. These webinars that we provide are not pre-registered or ASHA approved for CEUs. However, you can use them for self-reported CEU activity. So if you would like to do that, just email webinars@lsvtglobal.com to let us know that you attended the full webinar, the full duration of 1 hour, and we will email you a certificate that will include the webinar title, the duration of the webinar, the date, etc., so that you can use that for self-reported CE purposes. If you're not sure about your state and whether they accept self-reported CE, best thing to do is to contact your state board and learn the rules and regulations that way. The learning objectives are these. By the end of the webinar, we would hope that you can recognize the problems that can occur when a person with Parkinson's disease is hospitalized, either unexpectedly or even a planned procedure. Summarize the rationale for and the development of the Aware and Care Kit. List the components, what's in the Aware and Care Kit, and express how each of those can be utilized. Identify the process for obtaining an Aware and Kit, and support the goals of the Aware and Care initiative by sharing information about this resources with others in your community. So before we start our discussion, we really want to know who is joining us today. And so I'm going to pull up a polling question here, and it'll just take you a second to answer that. And I think Beth pulled it up, so we'll give you maybe 10 seconds to answer that. It shouldn't take too long. Let everyone have a chance to read it. Okay, it looks like everyone just about answered it. We'll give a couple more seconds. We've got about 81%, and if you don't want to answer the poll, that's totally fine too. Okay, and I'm going to share the results. Oh, Beth, can you share the results?
I see them.
Okay, you can see them. Okay, good. So it looks like, let's see, 10% person with Parkinson's, about 10% caregiver. So that's fantastic. We're happy to have you. And we have a bunch of speech language pathologists, 40% PTs or OTs, yay, PTs, OTs, and 16% other. So perfect. Let me see if we can stop sharing that. And that should have gone away, right? You can see my screen? Okay, good. So thank you, whoever you are joining us today, whether you are a therapist, family member, or a caregiver. I'm going to stop sharing my screen, and let's let's kick off some questions here. Now that we know a little bit about you, but we don't know so much about the Aware and Care program, Michelle, why don't you start? Tell us, what is the Aware and Care program? I'm sure people ask you all the time, and you have to define it concisely, right?
Yes, yes. So
Oh, I think we just lost Michelle. We'll give her a second to come back. All right. Michelle, are you still there? All right. Maria, are you able to jump in?
I can jump in.
Okay,
So she gets
great.
back. Okay,
Perfect.
so what is the Aware and Care program? Oh, there's Michelle. Go right ahead.
Oh, there you are.
I'm sorry. Again, technology always works until it doesn't when you really need it. So
yeah, I think we all understand that. Totally fine. So yeah, walk us through, what is the Aware and Care program? And Beth, you can just keep us all spotlighted. I think we'll be doing a lot of bouncing around.
Yes. So the Aware and Care program was initiated in 2011 through the Parkinson's Foundation. The goal was to help educate people with Parkinson's, their care partners, therapists, nurses, and physicians. Hospitalizations in people with Parkinson's occur more often than they do in the normal population. So we want them, Parkinson's Foundation wanted to ensure that those hospitalizations were as safe as possible. Oftentimes, individuals with Parkinson's who go into the hospital actually end up coming out worse than when they went in. So that's part of the whole goal for this, is to help people get their medication on time, get the right medications, and to not have any substitutions of the medications that might cause ill effects. So being in the hospital, if a person isn't getting the medications, their carbidopa, levodopa, when they need it, it's going to make it much harder for them to participate in therapy or nursing care. So as of October 2021, there were about 115 ambassadors for the Parkinson's Foundation. And these people consist of people like Maria and myself, people with Parkinson's, care partners, fitness people, as well as nurses who are the ambassadors.
Okay, great, great. And so it's been around since 2011, so going on 12 years now. I assume the program has grown quite a bit over the years, which is great, and continues to grow as well through the ambassador program.
Yes.
I do believe the ambassador program is newer.
Okay.
It's only a few years, but I know the last number I saw was that they've distributed over 10,000 kits, and that number hopefully will continue to grow. Michelle, I know I just became an Aware and Care ambassador this last fall, and they oriented a whole bunch of us in a lot of different states. And the goal is to get more people involved in spreading this message, this really important message of keeping people safe during a hospitalization if you have Parkinson's. So
yeah, so important. And as a PT myself, I certainly saw many people with Parkinson's who are hospitalized with for a knee replacement or things like that. And I think if you're a therapist that's ever worked in a hospital or nursing home, you're well aware of some negative consequences that can occur. But Maria, tell us a little bit about, what those negative consequences can be when someone, isn't armed with this information that's available through the Aware and Care Kit.
Okay, well, people with Parkinson's disease, as Michelle mentioned, are hospitalized more frequently. They have an increased rate of both emergency room visits and hospitalizations. So I think this data was between 2002 and 2011, there were more than 3 million hospitalizations among people with Parkinson's. And for some of the numbers they use, for every 12 people with PD, 4 of those will be hospitalized this year. Okay, and of those 4, 3 of them will have problems in the hospital, problems with their medication,
Wow.
problems with a lot of things there. And of those 3, 2, they won't get their 3 of the 4 won't get their medication on time, and 2 will have complications. And those complications can be things like an exacerbation of their symptoms, an exacerbation of psychiatric issues. A lot of those people end up in a nursing home. So the rate of people that have Parkinson's disease that get discharged home is much smaller than the normal population. So a lot of those people have problems. The number one issue is the medications, which we'll talk a lot about as we go on, but other things like the lack of activity and the lack of movement. Sometimes that's tied to the medication issue. Sometimes that's tied to whatever, brought them into the hospital. So if they have a fall, they end up in the hospital. The lack of movement is also going to cause an exacerbation of those Parkinson's symptoms, as well as those medications. So that timing, if you think 3 of those 4 hospitalized patients are not going to get the right medications or the medications on time, that's the number one issue. But there's a lot of other consequences of that create those problems. So they're more likely to be discharged to a short-term hospital or nursing facility. They often have worse symptoms when they come home, and 6 to 10% of people with Parkinson's die during a hospitalization.
Wow.
If they have Parkinson's. And what I see in home health, we see a lot of people who come out of the hospital from a fall, a pneumonia, an altered mental state, something that causes them to go to the emergency room or hospital. And a lot of times that diagnosis of Parkinson's, when I look at their information that comes back from the hospital, it's not even one of their top diagnoses. It's listed or it's buried in there. So in Parkinson's disease, it's a very complex disease. It affects, you have motor symptoms, non-motor symptoms. You've got all kinds of things to deal with. And if that disease that isn't listed on your list of diagnoses high up there or isn't even talked about, then you're not going to get the care that you need. So it's really an important thing, and can have tragic consequences too if you don't get the right
Right.
care.
Yeah, those numbers that you stated are pretty troubling. You know,
They
and hopefully
are
we can
very
begin to
troubling.
make a change with that through the Aware and Care program. And you know, this applies to admissions to nursing homes as well, I'm assuming, and not just admissions to hospital if it's a, you know, a new admission, right?
Right.
So the issue you're saying, you know, in part is the inactivity, right? That can happen because of being sick or having surgery or something like that. Another part of the issue is not getting their medications on time every time, which is really important for symptom management in many people with Parkinson's disease. And a third issue then is being prescribed the wrong medications that can be detrimental to them. And will you be talking about some of those as well as you go through the kit today?
Yes.
Yeah.
So that's exactly right. I mean, there's missed medications so that they
Mhm.
don't get the medications. And there's things that just get admitted because they're not, you know, they don't recognize those as a priority. Delayed, so that's the timing issue. If you don't get your medications on time, those can have, and then the substitution is another thing we'll talk about when we get to showing you how important having the kit and having that available when you go to the hospital, because a lot of hospitals have their own pharmacies and they don't carry necessarily your Parkinson's medications in the form that you're prescribed them. So we'll talk a lot about how to make sure you are able to get your medications, not just on time, but your correct medications.
Got it. Got it.
And I think a really important part when you're talking about the delay of the medications is we know that, like, ideally we want that medication to be delivered about 20-minute window, right, of when it's due. But when you go into the hospital, the vast majority of medications are delivered within a time range, and that time range could be 3 to 4 hours. So let's say that you take your medication at 10 o'clock in the morning and 1 o'clock in the afternoon. Well, maybe they don't have it set up like that in the hospital. So you're on the first shift, you get your medication between 10 and 1. So let's say it's closer to 1 o'clock, and then they say, oh, well, my next dose for you is at 3. So since I'm here at 1, I'll just go ahead and give you both at the same time. Right. So now you've gone from 10 to 1 without any medication, and now you're getting a double dose at 1 o'clock.
Yeah.
Then maybe you'll go another shift without that medication at 4 o'clock or 3 o'clock. So it really is important to understand the importance of how the hospitals work with the timing of their medications and be able to advocate for yourself. And I think ultimately that's what I think this program does for people, is it gives them the ability to be an advocate for themselves or their loved one with Parkinson's without maybe feeling as uncomfortable. Sometimes when you're in the hospital and you're asking for things, you feel guilty or you don't want to be that problem patient. But this kit, as we'll go through later, it kind of puts the blame off on the Parkinson's Foundation, if you will. It's like, well, the Parkinson's Foundation says I need this, and here's the reason why. So it really does help you be a better advocate and to be able to show them that this is legit and I'm not just being a problem patient, because sometimes those things can be inferred in a hospitalization.
Yeah.
It's a great tool.
Yeah.
Tool.
The tools to advocate for yourself. Yes.
A couple
and
of
Michelle and I talked Michelle and I talked a little bit about just, being able to be an advocate for yourself, or if you have a care partner, or some of those issues, if you don't have someone to advocate for you, just have, and you end up being taken, going into the hospital in an emergency situation, even if you can't speak for yourself, you have that kit available and it goes with you, then that information is there and provided to the staff that's caring for you. So you can also have a friend or a neighbor that's aware of this and knows if you go to the hospital, this information needs to get there with you. And in the days of COVID, sometimes, I know my father-in-law went to the hospital with pneumonia, and my mother-in-law literally had to leave him at the front door, under the tent, and he went in without his wallet, without a med list, without anything, right?
Yeah.
So that's
Yeah.
the worst case scenario where they don't even know what medications you're taking. So
Yeah.
having, there's a bare minimum of what you need to have, and then the kit needs to get there and be there to help you advocate for yourself. So.
Mm. Thank you. Michelle, do you have any personal stories of maybe when things went wrong because they didn't have that, or when it went right because they did have the kit?
Yes, I do actually. We have had, actually, I want to share one thing. We'll show this again later as well. But this is a card that comes in the kit, and it's one that you keep in your wallet. And the biggest thing here is that it says, I am not intoxicated. I have Parkinson's disease. So this card could have prevented one of the gentlemen in our group from getting kicked out of a Barnes and Noble in Kansas City. So he was experiencing off times and was not able to move well in the Barnes and Noble, and the staff thought that he was drunk. So they made him leave the facility. But had he had that card, that might have prevented some very uncomfortable situation for him. Another instance of success is that, as Maria mentioned, it helps you advocate for yourself, even if you're alone. So we had a lady who went to the emergency room, and the doctor wanted to give her a medication that is on the list within the kit that is not recommended for people with Parkinson's. And she showed the physician the list and said, I can't have this. And he's like, well, I'm going to just give you a little bit. And she's like, no, none of it. It's on my list of do not give me. It doesn't matter if it's a drop or a huge dose. I don't want it.
Good.
So, and then another instance that I think is really important that can often get overlooked is people planning for surgeries. So maybe you're planning to have a knee replacement or a hip replacement. When you have your meetings with even your physical therapist, when you have your meetings with your anesthesiologist, take your kit with you, share with them your medications and the things that you can and can't have, and the need for your medication on time all the time. So it really helps you from pre-admission to admission and all the way through discharge and home health.
Great. And we're going to get into the kit in just a second. We have a lot of therapists attending right now. Many of them have great expertise in helping people with Parkinson's disease and other movement disorders. I think the goal is always to empower a person with Parkinson's to advocate for themselves, and if not possible, have their family caregivers advocate for them. But what about therapists? We have that kind of tender thing we need to respect of, medications really aren't in our scope of practice. However, we're part of the interdisciplinary team, oftentimes round on patients and such. So do you see this as, a way that even therapists can help to advocate for their patients who they're seeing who are hospitalized?
Well, I'll speak to that because in home health, we are responsible, and medication reconciliation is within our scope of practice. We are not prescribers, but it is within our scope of practice to do a medication reconciliation. And in home health, that when we do see patients, we have to document that we are checking their medications every visit and anything new. And at the start of care, we have to type in everything they take. We're over the counter, as well as prescribed medications, timing. We have to look at high risk medications and do all that. So, as therapists, it is part of our job to help manage that. And especially as a physical therapist, I'm looking at our people's medications optimized. No, I'm not going to prescribe them, but I'm definitely want to be very aware of what they're taking, what their timing is, and be able to educate people with Parkinson's what to speak to their physicians about, how to bring this up to their doctor, and to recognize that, hey, my timing may be off, or because they don't have time. The physicians don't take the time to educate. So it does fall to us as therapists to do more of that education piece. And the tools in the kit also help you understand a lot more about medications as well too. So I do feel as therapists, that's part of our role.
Thank you.
Yeah, and I think, Maria, do you want to share a little bit about how the value, knowing that hospitalization stays can increase 2 to 14 days longer for a person with Parkinson's than a person without? Can you kind of share a little bit about how the timing of the medication can impact their performance in therapy in the hospital, where that might lead them to go post-hospital stay, and then in those next settings?
So that those statistics of, the higher percentage are going to skilled nursing and onto rehab type facilities rather than going home. That's a critical thing. What happens when your timing of your medication as a person with Parkinson's is unique to you. And it's highly variable. The types of medication are very variable, and the timing is very variable. So I've had people with Parkinson's that take their carbidopa levodopa every 2 hours. You have others who are on specialty medications that are such as a Rytary, or they have orthostatic hypotension issues and they're on specialty medications for that or for their psych symptoms. And those are the medications that need to be kept the same. They can't be substituted for other ones, and the timing needs to be, within that range of time, not on the set schedule of the hospital timing of when they give them. And some people I know have, especially if you have a freezing of gait issue, you may have a rescue medication, you may have an inhaler or an injection you can use, you may have a PRN dose of carbidopa levodopa that you would normally carry with you. And if you start to have an off episode or freezing episode, you can use that. And all that, to have that accessible for yourself in the hospital, then you need to plan ahead for that, because the hospital's not going to have that or be able to do that unless you can do it in the manner that they're able to help you use your own, when we go through the hospital action plan, we'll go through that and get into the kit. So that's where how do you actually do that as a person? What do you tell your people, your patients with Parkinson's, how to manage this on their own? So that brings us to the kit. And I think
Michelle, show us the kit.
So this is the beautiful kit. It is actually a wonderful tool. It helps you to keep your medications within the kit. One of the things too that we recommend is for people to keep their will, their DPOA paperwork in here as well, so that everything is there, especially when we're living in the times of COVID. And like Maria said, you might be in the hospital by yourself. So it is just a nice bag with a good zipper. It's very durable, and it has plenty of room to add your actual pill bottles in it. Another thing too is that you don't have to have just one kit. So some of our people have one in their car. Keep it updated. That's the most important thing. So you want to have both of your kits updated to your current medications, but keep it in their car, and one keeps it in their home, so that they have one just in case something happens. They don't have to worry about going to the hospital without one. So within that kit then, Maria, you want to start with the action plan?
Okay, so the action plan is really all the information that you need to kind of get started. And it starts with the explanation of the 6 basic steps to get the best quality care in the hospital. And number 1, it's preparing yourself at home. So it gives you basically a checkoff list of how to fill out the forms, what to do with them. But the best way to avoid problems is to plan ahead and be prepared. If you don't have this kit, all of these forms are available to download and print online. from the Parkinson's Foundation, and that reference is in the slides at the end. So you could have a Ziploc bag and print off the forms and manage it that way as well. But the kit is nice, it's recognizable, it's obviously, relates to Parkinson's, and it's going to be paid attention to better than other ways. But if you need forms or you want to provide forms for your patients just to help them, those are available to print up for free.
Great.
So it starts with, looking at how do I prepare, having a medication form. So having those prescriptions there, the medication form is small, and it's, a sheet here, but you may also have your own medication form that you have a typed up version or an Excel spreadsheet. That's what I would use in that place, because it does need to be updated, but you needed that medication form with the dosages and the timing on that. There's a medical alert card. Do you have that one handy? That's the one that Michelle showed you. That medical alert card is very important, and it's foldable and meant for you to carry with you. So it talks about the medications and the things that you should or shouldn't have as well too, because there are medications that are dopamine blockers. So you're taking medication to replace the dopamine that you don't have as a person with Parkinson's. And if they give you medication that is a dopamine blocker or that interacts with your medication, you can have, tragic consequences from that. So having that medical alert card and carrying that with you is important.
Yeah. And
having an emergency contact list.
Sorry, Maria. I think one thing to make sure of with this is that this is one that you want to keep in your wallet. So this is one of the things that you want to take out of your kit and keep with you separately, so that it's with you when you're walking, dining out, whatever it is. And I think, again, the other important thing is so it gives you all of the details, as Maria said, about what medications are safe and what ones you have to avoid. And that's just really critical. Like, for example, Haldol is something that a person with Parkinson's should never have. So that is listed on here. And then another key component is making sure that the doctors don't just do a cold turkey stop on your carbidopa levodopa. That can lead to very detrimental effects. So again, that's listed on all of this literature here.
So even if they are meeting with the anesthesiology for a pre-op visit, this is something they should have with them.
Yes,
Got
absolutely.
it. In case they need to be off that drug for a period of time, right?
Yes, correct.
Okay.
If they do, and it needs to be, if they're an NPO or they're before surgery, it needs to be discussed. Does that mean, like, make sure that you're on the same wavelength with that? And consequently, after any kind of any kind of issue, especially with dysphagia and people with Parkinson's have a lot of problems with safe swallow. There are there's information about how to, use a liquid form of carbidopa levodopa and all of those things that a speech therapist can help you with there. But as far as that alert, there's also a bracelet that comes in the kit that you can wear. So it's just an alert bracelet that says Parkinson's disease alert, see wallet card. So that if you were found down out in the community and the EMS is called and the paramedics come, they're going to have this idea. They're going to know that that's one of your issues, and they're going to know to look for that card. It's similar to using the medical alert on an iPhone, right? So iPhones have an emergency ID so that a first responder can access your iPhone and bypass your lock screen and look at your medical information. So, this is one way. Having that information is available in as many places as possible. This comes in a kit as well. Again, it's that alert. It's a refrigerator magnet, and first responders are trained to look at your refrigerator for a DNR, that pink post form. Got it. Right? It's supposed to be, you have that DNR, if you have that out of hospital DNR, it's supposed to be on your refrigerator and somewhere where when a paramedic comes in, they know not that you are DNR. And this is another place that can be. So those are your kind of alert things that are all handy. And I know I've had people in my community say, oh, do I have to wear the bracelet? No, you don't have to wear the bracelet, but especially if you're one of those people that has the dyskinesias or has severe
Yeah.
freezing and off times, it can be helpful, if you,
Mm.
you can just sit, show that, and people are, oh, okay, they have a medical condition, and it's very
Mhm.
helpful.
So if I were a person with Parkinson's disease and let's say I had a hospitalization coming up, I had my kit with me, I was prepared to use it. Can my caregiver also have a kit so that in the case that I can't really advocate for myself, my caregiver can step in and have all the tools they need?
Mhm.
They
Yes,
can each have one, that's okay.
absolutely. Yeah. And the
Absolutely.
other thing that's nice too is that there are lots of sheets. So for example, the fact sheets here
Mm,
that tell about, the different symptoms of Parkinson's, and then again, what medications to use and not use. There's a whole pad of them.
great.
So I talk about like, hey, everyone that comes into your room, just give them a piece of paper and say, hey, I have
Yeah.
Parkinson's. Here's what I need. So
Mhm.
yes, absolutely, you can have as many as you want. We, as was mentioned, you can also print off all of these forms on the website. So that makes it really, really easy to take care of that too.
And the
Mhm.
printed forms are actually bigger and easier to fill out and read. Like this is the
Okay.
medication form, and it has information about contact information, other comorbidities or diagnoses that you have, a list for your medications. There's special considerations on the back, things like I have special dietary needs. I get dizzy or feel faint, which is very common. If you have Parkinson's
Mhm.
related dementia, hallucinations, you can check those
Yeah.
boxes and carry that in your kit. I
Mhm.
think Michelle was going to mention there's 2 other alert things in there as well for special things.
Mhm.
The
Yes,
dual-
absolutely. There, so several people that we know in our programs, and I'm sure you've experienced as well, have DUOPA. And
Mm.
that is a system that a lot of people aren't as familiar with. So this card gives an explanation of that front and back so that people understand what that is and what your needs are as a patient with DUOPA. And then there's also one for a deep brain stimulation. So again, it's just talking about what is DBS, what can happen, what can a person with DBS do and not do to help you keep as safe as possible. Especially, if you were to become unconscious and they took you in for emergency testing, if you had this kit in your car, the EMTs will see and be able to give you the best care.
Mhm.
That's really important with DBS because you can't have a lot of, the DBS stimulator needs to be turned off before you have some of that diagnostic testing. So that's really key
Right.
that
Right.
is evident there.
Mhm.
So that's a lot of
Okay.
information. There's also in the kit information about the health proxy. So who can help make decisions for you? And as Michelle said, if you have a DPOA or information that somebody is your durable power of attorney or makes medical decisions for you, having those in there is important. And the medication piece, so keeping an extra supply of your Parkinson's medication to take with you while the hospital's sorting it out, because when you get there, they may not have in their pharmacy, because hospitals have their own pharmacy, your particular medications. So that's when we're talking about actually carrying some of your medications with you. The key things to know is that it has to be in a medication bottle, in the original bottle with your name and the dosage on it. You cannot take you can't take your pill box and take
Okay.
it with you. They're not going
Good
to let
tip.
you take those medications
Okay.
because they don't know what they are.
Yeah.
So it needs to be one of your original medication pill bottles with a small supply of your medications, and it needs to be kept current. So when we discuss this, and when I discuss this with one of my support groups, it's like thinking about your emergency kit. If you're like, here, we live in earthquake territory. Michelle, you probably have to worry about tornadoes, right?
Yeah.
And if you're on the East Coast, maybe you have, to worry about hurricanes and you're evacuate. If you had to evacuate, what would you take with you? So that emergency kit, but it needs to be supplies that are kept current. So if once a month, or when you get your new pill bottles and you finish using those old ones, then the suggestion is go ahead and fill your pill boxes with what you've had in your kit for the last month and put fresh ones in, and take maybe a 3 or 4 day supply to get you through those first few days while they figure out whether or not they can supply that through the hospital's pharmacy. Or, you just have to be that advocate that, no, I need Rytari, not generic carbidopa levodopa. I need my Northera for my orthostatic hypotension, or when I get up, I'm going to pass out and faint and fall. So taking that supply is important, but it is important. It has to be current. It has to have the original bottle, and it needs to have the correct and updated dosage and preferably timing on it as well too. So
those are great tips.
That's the hard part. It takes a little bit of planning and then staying prepared.
But it can work.
But it can work, and it can work really well.
Yeah.
And having those tools in the kit to be able to show the nurses or the physicians this is coming from the Parkinson's Foundation. It's coming from a national organization. It's not just me saying I read online that I need this. It makes it very reliable. And there's also a 1-800 number, the helpline to the Parkinson's Foundation, that's available to people as well too, that they can get help with as far as advocating for themselves as well too.
I'm going to pull up a couple of slides here while you're talking about that. Hopefully you can all see that now. This is one of the questions I had too, since we have so many therapists in the audience, is it okay for them to have a kit or two in their practice, whether they're an outpatient hospital, home health, whatever setting, to show patients like, hey, you need one of these. This is what a kit looks like. Here's how to get it. Is that, can they do that as well?
Yes. I think everyone should have a kit to show and be able to explain and show. It's, it's something that they can send for. You can hand your clients or your patients a card that tells them how, and you can get those cards through the Parkinson's Foundation. You have a slide, I think, at the end or in their handout, so they can get a free kit available for them to have as a demo. And then they do ask, they because there is an expense with putting those kits together and mailing them out, they do ask for a postage fee or a shipping fee, but they will waive that if you really need that. Or if there's a wear and care ambassador in your area, we're able to get more kits and hand them out a little more regularly. So if you have a support group, you want someone to talk to, if you have an aware and care ambassador in your area, then say, for example, I can go to your support group and bring kits and hand them out and walk people through the kit, go through the slideshow and help them get prepared that way. Because we as ambassadors can get, kits to give out as a thing. But at the very minimum, having the postcards or having a handout or a sheet that you give them, all of that's available through the Parkinson's
Foundation. Okay, good.
And the helpline is fabulous. If people have any questions, they can call that helpline, and they try really hard to get the right information and direct them to the right place. So looks like
we got some annotation there. Okay.
There you go.
That's fine. Okay, we're kind of getting towards the top of our hour, and I want to leave a few minutes for questions. Can you tell us a little bit more about the Aware and Care ambassadors? You've talked somewhat about how they educate the community. Is there anything else that they should need to know, or is there any information for maybe anyone in our audience that's interested in serving as an ambassador?
Yes, so as this slide shows, the ambassadors educate the community. So we go to, different support group meetings. We can go to nursing schools, therapy schools, any type of educational program. We really like to try to advocate education for those who are getting into the field, so that as they go out and start working, they've already got that knowledge and they can help make those changes within the field as well. Also, as we said multiple times, educating people with Parkinson's and their care partners is so important. You're the ones that need this the most. You need to be advocating for yourselves, and this kit just gives you the tools to do that effectively. Also, educating those that work in the hospitals, in long-term care, assisted livings, those places where individuals with Parkinson's are going to be residing or receiving treatment. The more of those staff that know and understand the needs of people with Parkinson's, the better care they're going to receive and the better their outcomes for quality of life, health, and safety.
Got it. And so if they wanted to become an Aware and Care ambassador, they would just contact the Parkinson's Foundation to indicate their interest, and there may or may not be availability. I know your program has grown a lot.
Yes.
There is such a need when you think about, the number of staff in hospitals, the nurses, it's because of the complexity of Parkinson's and how rapidly everything is changing as far as, how we treat Parkinson's and medications. There's no way for all of those clinicians to have that specialist knowledge that we have.
Right.
If you're an LSVT therapist or you have you specialize in Parkinson's, that's great. And a person with Parkinson's, you're maybe used to talking to their movement disorder who is a specialist in Parkinson's. Now they're talking to the hospitalist who doesn't have that specialty knowledge. So educating the hospital staff is the big project, and it's going to take more than a village. It's going to take an army to really educate all the people that need this information.
Yes. I know, in my own career, I've talked to many patients and families who are surprised that, not every doctor or not every nurse knows a lot about Parkinson's, but you're right. It's very complex. Their knowledge is expanding greatly, and they have to learn about every disease when they are in nursing school or medical school. So this is really important. Annie Wallace, who's with the Aware and Care program with the Parkinson's Foundation, just stated in the chat that the application's open in the summer. So if you are interested in becoming an ambassador yourself, just know that in the summer it's coming. All right, we have just a few minutes for questions left. And so just as a reminder, you can type your questions into the chat box in your control panel. That's probably the easiest. If that's not easy for you, however, if you're a really bad typer like I am, you can raise your hand. You can physically raise your hand. There might be a little icon in your control panel where you can raise your hand, or you can unmute your microphone and we'll find out who you are. If you think of something later, you can always email info@LSVT Global and we'll direct the questions to either Michelle or Maria, or if it's related to LSVT, we'll try our best to answer those questions as well. And while you're typing in your questions, I just want to let everyone know that we have a webinar in March on simple strategies to help you transfer LSVT improvements into your daily life. This intended audience is people with Parkinson's and their family members and caregivers. So this is going to be a really helpful strategy and helpful webinar, I think, to learn different ways that you can use that louder voice and bigger movements in daily life more effectively. And that registration is through blog at lsvtglobal.com. Click on the events tab, scroll down to the March events, and you should find that. All right, we'll wait a couple minutes for questions. And Michelle and Maria, is there anything else that you would like to add in that we didn't get time to touch on, or any key points that you want to reinforce before we sign off for today?
I was going to just say that, first of all, there are a couple of slides within your presentation here, so just make sure that you check those out. One is talking about just the differences, how important medication is, how everyone is different. Yeah, that's exactly it. So just pay attention to this slide as well. Knowing that number 3 there, that care partners can have all of the above information and advocate, but also that it just gives you the tools to advocate for yourself. I just can't say that enough. And as a therapist, I think practicing advocating for yourself in therapy is really important as well. So in speech, in our LSVT loud sessions, one of your functional phrases can be, I need my medication on time every time. Take this and make it functional. Don't give me Haldol, whatever it is, but practice those things that are going to really carry through your safety and your return back to home as quickly as possible. So I think that's important. And
Thank you.
I also just want to say, if those of you therapists have not checked out all of the Parkinson's Foundation resources at parkinson.org, please do that. It's great for people living with Parkinson's and care partners too. But the things that they provide for us therapists and specialty populations are really valuable. So just check out parkinson.org. You can look into team training opportunities and additional therapy training things as well. So utilize all these resources. It's an amazing opportunity to work with the Parkinson's Foundation for your specialized training.
And I would finish with, to follow up with what Michelle said, using those Parkinson's organization, the Parkinson's Foundation resources. There's a clinical education webinars. There's a speech, an OT, and a brand new PT one, and there's a nursing one. And you can watch them for free. If you are not comfortable with that medication and reconciliation, then you go in and look at the Parkinson's Foundation nurse webinar for nurses, for clinicians, and listen to that and watch that webinar, and that will help you have a better understanding of those medications yourself, so you can educate and advocate for your patients. So those resources are highly valuable.
That's great. I echo what both of you said. As a therapist, I mean, the Parkinson's Foundation is the go-to place to really quickly and efficiently pull educational materials for your patients. They have it on, I think, every topic you could ever imagine related to Parkinson's disease, motor, non-motor, caregivers. I mean, just really
there's
everything.
A whole list of things you can order for your patients in English and Spanish. And those resources are free. They're great. Great to have those on hand, and then provide your clients or your patients with this to send in, or they can call in, they can mail in, they can email, or whatever they're comfortable with to get more education. So to be your own advocate, you need to have that education and the resources to do it well.
Absolutely. Well, I just want to thank both of you for taking time to share all of this wonderful information with us today. We're so proud and happy to collaborate with the Parkinson's Foundation and this joint effort of really improving the lives of people with Parkinson's disease everywhere. So thank you so much for your time. This webinar is being recorded, and so if for those of you joining us, if you have friends, family members, colleagues that you want to share this with, this will be available on demand on the LSVT Global website, which will be blog.lsvtglobal.com. Click on webinars and you'll be able to find this recording. Share it like wild with everyone that you know. All right. Thank you both. And I wish all of you a very good day.
Thank you.
Thank you.
Bye-bye.
Welcome.
Bye.
Bye.